Good evening again.
Good evening.
And congratulations for your fabulous presentation in this 19th edition of the conference. It was a pleasure to have you here because you really changed the world around you. And it was really memorable what you said, that medicine without this sexual part is not medicine anymore, and everybody should know at least common sense things about what does it mean to be involved in sexual medicine. So
first of all, I have to say that I'm so happy to be here in Romania for the first time. It's my first time here. Even if we have so many connections between Italy and Romania in this country. And also I have to say that I found a wonderful environment with such a nice questions and interactions, which make me very happy to be here. Yes, it is true that the sexual medicine, medicine without sexual medicine is not medicine. It's something that is new in some way, because at the very beginning of the history, sexology was not considered a part of medicine. Sexology at the beginning was considered something psychological, not really based on the evidences, but based on the opinions of the key opinion leaders or something like that, like Sigmund Freud or others. They did a lot of wonderful job at the beginning, but sexual activity, sexuality, reproduction, biologically speaking, is the most important issue into the human nature. We are here because of sexual heart. We are here because of sexuality. And this is the reason why I'm always surprised of the fact that if you look at the books of medicine, where there is something about sexuality, it is at the end of the book, the last chapter of the book, which is ridiculous because it should be the first one, because everything is coming from sex. So the first act of the biology of the life is the sexuality. And it is strange that medicine did not understand that role of medicine in sexual health. But the things are changing. The things are changing because basically we are growing so much in not just in knowledge, but also in science, which is another issue which is tremendously new. The fact that after the so-called Viagra revolution, the people in the field of sexual medicine understood the need to increase the amount, the weight of science, of evidences, of numbers in the field of sexual medicine, which is not now just matter of opinion, but it is matter of evidences. It is in fact evident that we are producing a lot of meta-analysis, well-conducted studies, and I think that the sexual medicine field is the most modern and the most developing, let's say, field in the whole medicine in some way. Also, there is another issue which is very much related to it, is the fact of the education of doctors about sexual medicine.
All type of doctors you're talking about now. I mean, from the GPs to all specialties they must have some information about.
They do.
They do. They must have. But do they do?
No. The point is, I learn here in this congress in Romania that for many, and I got it, and this is very interesting for me, for many doctors, there is a kind of coming out need to show that they are interested in sexual medicine, which is completely ridiculous. That is not.
It's trendy.
Yeah, it is. But it's something which this is the real representation of what is happening. The fact that some people, some doctors, some medical doctors are still afraid to say that sexual medicine is not a hobby, is not just something which you can do or maybe you cannot do, or you is not a real medicine, is not a real science. And so they try to find the courage to make a kind of coming out. And this is ridiculous because sexual medicine is producing so much amount of data, of evidences. We have a lot of nice journals. I am the chairman of the publication committee of the International Society of Sexual Medicine, which is the ruler actually of the 3 journals of sexual medicine, Journal Sexual Medicine, Sexual Medicine Review, and Sexual Medicine Open Journal. And these 3 journals are producing so much amount of data, but we are also facing the other journals coming from other publishers. They are also publishing a lot on sexual medicine. So we cannot say that the sexual medicine is something outside science, outside medicine.
And you're an endocrinologist.
I do.
How about your colleagues there that are working, and most of them are what? Endocrinologists, urologists? What specialties do they have, the people that are involved in sexual medicine? Because sexologists, like themselves, they're defined like this. In Romania, just a few.
Yes. But they will increase as soon as they understand that it is a part of medicine. Yes, it is true that the endocrinological field did not understand as soon as the urological did the importance of being in the field of sexual medicine.
Surprising for me.
It is indeed. It's not making sense because basically hormones are regulating sexuality.
In your yard, yes.
No question about.
Okay.
But it is still a problem, actually, the fact that the endocrinologist should remember. I'm always joking with my friends endocrinologists when I'm discussing about testosterone. I am starting my communication about testosterone saying something like that. You know, my friends, I have a discovery for you. I discovered that testosterone is an hormone. And
do they laugh?
Well, some yes, some others not. Not so much. Yeah, and since the endocrinologist, the doctor, supposed to deal with hormones, the fact that around the world, the large majority of prescriptions of testosterone is done by the urologist is not making sense to me. Because testosterone is a hormone, no question about, and the endocrinologist should take care of it. Also because, this is not so common in Europe, but it is in the United States. The prescription of testosterone are not so good. They are prescribing too much. While in Europe, we are not prescribing enough. So there is...
It's a defensive medicine, or why?
It's a defensive medicine, it is indeed. But also... it is something which is coming from the endocrinological culture that my colleagues, endocrinologists, they not always understanding that testosterone is an hormone.
I like
as well.
Sincerity.
It is true.
Yeah.
It's matter of fact. It's matter of evidences. If we have a picture of the prescription of testosterone in the United States, which is the biggest market, I think that is about 85-90% from the urologist and the
rest is
the endocrinological. So this is not making sense because
at all.
I have to say that testosterone is an hormone.
Okay, so you're talking about the fact that sexual medicine is going to develop.
Yeah. Yes.
On the other side, we are facing, at least here in Romania, the fact that We are not having sexual education. A lot of people are still not very familiar with common terms. I mean, when we talk about there are 30 years since the revolution in Romania, and still we cannot talk. Our parents, it's
a taboo.
still a taboo, and it's amazing, because on the other side, there are a lot of countries that are still fighting in order to have the abortion forbidden. Women must stay at home. This feminism,
homosexuality, transsexuality.
Yes, for the first time in history, we are having a transsexual that is in the German parliament for the first time. From one point of view, the world is developing. From the other point of view, we are going back to caves. So it's really amazing. In Romania, we are unfortunately on the first position in Europe regarding pregnancy in teenagers.
Not really. England is also facing the same.
England is it's still in Europe.
Yes, for a few weeks.
We don't know.
But the England, this is a very good point. Actually, it's very much related to the sexual education, and it is also related to the general education, not just the sexual one. The fact that there is a record in Romania and as well in England, trust me, the number of abortion in teenagers is tremendously huge in England. Well, it is a Puritan country, actually.
Yes.
And the Puritanism, which may be related to the past of this country, is something which make this plague, this terrible issue, more diffuse, because if young people is allowed to talk about contraception, about sexuality, about what to expect from the future, of course there is not such a big risk of this tragedy, which is actually the abortion when people are so young, is something which is not to be considered, okay, who cares? No, not at all. Not at all. We did an experimental protocol in Italy, in the L'Aquila University, where I was teaching at the beginning, basically showing that young people doing the abortion, young girls doing the abortion, were affected by sexual dysfunctions much more than old people, because the old women or the girls were in some way more able to face or to handle the, let's say, the failure, the tragedy of which is the abortion. And we demonstrated actually that being young is a risk factor in some way. So this is stressing the need for education. And the fact that what you said is terrible, actually. The fact that there's still this society, as it is also in Italy for some reasons also. In some part of the country there is the same, more or less. The fact that talking about sexuality with a doctor is not so easy.
In Italy also.
In Italy also. What is, I have to say, quite now, after 20 years of Viagra revolution, is the fact that male people, they find easy to talk with a doctor when they are old, like me.
You are not old. So find another reason.
But anyway, they are able to talk with a doctor. The problem is that the young people are not talking with a doctor. Because they fear that the erectile function failure of sexual problems should come in the mind not because of the they do not deserve a medical treatment, so they are not facing a real, not looking for a real doctor for treating of the erectile dysfunction. So I have to say that what is going good in Italy is the old people coming to the doctor for erectile dysfunction, sometimes for premature ejaculation, but not so frequently, much more for erectile dysfunction. While young people, they are looking for something else. And we have an epidemic in Italy of drugs used, illegal drugs,
also
used for sexual purposes.
Yes.
Not just for the other things which are driving the market of drugs, but specifically for the sexual aid need. So in other words, the fact that the doctor was not considered the right target, the unique target in order to find help, in order to find solution, the young people, they are going into the black market, into the dark market, into the drug market, in order to find the same solution that they were looking for. It is quite a common mistake, the fact that we always think that young people should work, should function sexually, which is not really true. There are a lot of people, young people, they have a psychological, they have relational, they have medical, not so much studied yet, medical problems, but all those things can be fixed by the medical expert, the doctor expert in medical sexology, in sexual medicine. But the young people is not, let's say, culturally allowed to go to the doctor. Because if I am 25, if I am going to the GP, my GP, what he or she can say to me? Okay, you are young, you are 20, you are 25. If I am like you, I will do, don't worry.
It's the same thing like with the elderly people.
Yeah.
You are old, what you want now?
Exactly, the contrary, but it's the same. Yeah. Exactly, you got the point. So the communication of the doctors is making the story.
We
definitely.
have another big enemy here in Romania, the priests. Cannot
the church.
I'm very honest also.
Yeah, you're right.
I mean, we are having hours for religion in schools.
Yeah.
So there is not enough time to introduce 1 hour per week for medical education.
Which is crazy.
It is crazy.
It is crazy, yeah, definitely.
How are things in Italy?
Well, we have a similar. We do not have institutional education of sexual medicine or sexology or how to make babies, how to avoid to make babies in the schools. But we are almost obliged to have a religious hour.
So it's also in Italy.
Exactly the same.
It's amazing. It's not amazing because the last American president, they were elected after this kind of campaigns, that forbid abortion. That this is how.
The fact that this is a main point, actually, sexuality is used by some politicians as a weapon, as an instrument, as a tool, in order to gain some votes, some power, something like that. So my suggestion is this one. Be very clear. If you are looking in the television to a politician who is using sexual issues, sexual terms, sexual aspects, facing abortion, homosexuality, transsexuality, you never trust him or she. Because definitely he doesn't know what he or she is speaking about, no question about, and is just using the argument of sexuality in order to have votes when he or she is unable to have votes for other reasons. So these are very clear suggestions. Never trust a politician who is using arguments about the bed. The bed is nothing about politics. So the politician who is talking about what is going in the bedroom is not a good politician. Is somebody who is doing a trick against you. The bed is something which must be private. It's your bed. It's your bedroom. And if you have problems in the bedroom, you have to go to the doctor. Not the priest, not to the politician, but to the doctor, because the doctor can help you. But if you are listening somebody, or you are solving somebody who is talking about sexuality in the politician way, don't trust him or she. Don't vote him or she, because he is making a joke. He doesn't know what he is talking about. He doesn't produce any evidence, scientific evidence about. So this is a very simple way to decide what to do in the whether you have to choice for the democratic vote in your future.
Oh, that was the strongest message I ever heard about it, and thank you.
But it's a matter of evidence. It's a matter of evidence.
Yeah, how about the women at menopause? Which are their chances to have a good sexual life? Because most of women, I don't know how it's in Italy, but in Romania, it's like life ends.
Yeah.
You have to
sexual life is over.
The whole life, because
maybe sometimes the whole life. That's true.
So, do they have a chance to? What do they have to do? To go where, to talk with whom, and which are the solution?
We have it. Actually, in the developing countries, half of the female population is in menopause, and will be in menopause in a few years. So this half of the moon should be considered as sexual actress, must be considered as having sexual desire, intimacy needs, which are not so much considered usually by again, it's a matter of education of the doctors in this case. I saw many times in Italy patients coming to my office. I'm a typical second opinion doctor, and those patients are coming to my office and they said, we were, as a couple, to the gynecologist, and the gynecologist said, well, what you want? You are 55. The nature is that you can have some problems into the penetration during the coitus, during the intercourse, so it's natural. What you want? It is completely wrong. It is wrong because menopause is not unnatural. It's a disease when the menopause is symptomatic. I'm very clear about it. Some people in menopause do not have any symptom. This is a healthy or paraphysiological menopause. Okay. But some others, half of them, 50% of them, they do have symptoms, clinical symptoms. How to call them? How to call those women? They must be called as sick menopause. And the menopause should be considered a disease which must be treated by the several possibilities the doctor have. So the idea to accept menopause as a natural consequence of the elderly is wrong. Otherwise, you have to consider as natural the possibility to die before 50, which is the natural program. Naturally speaking, The large majority of women should die before 50. But we do not accept, and we are quite happy that we are surviving more than 50. So while you are accepting menopause as a natural thing, which is not a natural one, the symptomatic menopause, the menopause which is delivering the inability to make sex, the pain coming from the intercourse, the vaginal problems which are coming from the attempts to make sex despite the loss of hormones, these are symptoms. And the symptoms, in my stupid medical mind, symptom means a disease. And when I solve symptoms, I try to understand which is the disease and how to treat them. Could be. I have another point about it, is the fact that who is the doctor for gender medicine?
Yeah.
Who is the doctor who is dealing with the differences between the two genders?
Who?
The endocrinologist. There is no question about it.
So...
The endocrinologist, because the differences in the body, in the behavior, in the mind, in the sexuality, all those differences between the two genders are coming from hormones. And as far as I know, the doctor of hormones is the endocrinologist. Okay, that's something which is logical in nature, but it's not so frequently understood actually. Because many endocrinologists believe that endocrinology is just something about thyroid, maybe weight, maybe osteoporosis, sometimes not always, and diabetes.
So...
That's it, which is tremendously wrong, actually, because, as I said before, the endocrinology is the doctor of gender, is the doctor dealing with the gender medicine, with the differences between male and female. You know that if a female is taking aspirin, her body is completely reacting into a different way with respect to the male one. The expression of heart infection in female is completely different from the male one. So this is called gender medicine, and is based on what? On hormones.
So gender medicine is the first time when I hear this term, but you are changing the word, so I'm not amazed. Is something that is already fixed? So you are talking around the world about...
No, it is fixed. And we got a kind of bill of law in Italy that gender medicine should be taught in the medical school. Because there are so many differences between the female and male body with respect to the same treatment, the same disease, the same symptom can have a different expression into the male and female. So the fact that we have some differences in chromosomes, we have some differences in hormones, is making sense in some way in medicine. It's not something that we can ignore. So that's the reason why the gender medicine is something new. But the question is, who is the doctor dealing with? And no one can do better than the endocrinologist.
But do your colleagues with other specialties, do they call you and ask for your opinion? I mean, I don't know, internal medicine or other kind, are they calling you to ask your advice because you're, oh my God, you're famous?
That's another problem of the endocrinological field, actually, the fact that in Italy, when the internal medicine doctor, when the urologist, when the psychologist, they cannot find a solution, they call the endocrinologist as the last possibility.
So you're not the first to
No, I'm always the last one.
I cannot believe this.
Yeah, that's the matter of truth, actually. The fact that I'm the last hope for the patient. When they are unable to do it, they call the endocrinologist, because the endocrinologist is supposed to be the the top of the...
How about nurses? Do you have? I mean, How about their development in this new field? Let's say new.
Very good question. That's one.
Do you have in Italy nurses that know how to deal with this kind of patient that can help you in order to deliver the information?
No, I like it very much. This question is the first time that I'm answering about it. I have some ideas about it. The fact that we must increase the education of nurses about sexual medicine in order to face the inability of the common doctor, the common urologist who is not having time for dealing with the sexuality. So the education nurse will be tremendously important in order to face it. We do not have a real system of education in Italy, not yet. So it is something which I'm really thinking about very much in order to increase also the education on the nurse. But the issue is that, honestly speaking, the role of the nurse in Italian system, health system is growing, but is not as good as in other countries. So it is growing, but we need to learn, as doctors actually, we need to learn how to, let's say, use or face or collaborate with the nurses into the fields where we do not have time, we do not have skills, we do not have practice, and the urological field is one which may really enjoy good educated nurse in sexual medicine, because usually the urologist is not giving so much time to the patient. I'm always telling to the patient, if your doctor is not speaking with you about your sexuality for at least 45-60 minutes, you better change the doctor. because it's impossible. The first visit, if you are dealing with the sexuality, you are telling your sexual issues, your sexual life, your sexual hopes, what you expect from the doctor, and he or she is dealing the story for, let's say, 5, 15, 20 minutes, is not a sexologist, is not an expert in sexual medicine, is just a plumber, is just it's not dealing with sexual medicine. So the suggestion is, if those kind of doctors are not interested in giving to the patient so much time, definitely they must learn how to use the nurse. And the nurse must be educated in sexual medicine. That's the issue. So I'm not against the role of a urologist in sexual medicine, which is tremendously important, but I do am against the fact that some doctors, not just urologists, GPs are doing, endocrinologists too, and internal medicines are doing the same, are not giving enough time for the patient to speak about sexuality, and if they have no time, they must use, let's say use, which is not a correct term, they must
accept the help of...
look for the help of somebody else who is able to give time to the patient.
Okay, and the last question, but it's very, very important. In Romania, a lot of people are going directly to pharmacy in order to find solution. And
this is a Latin style.
Yes, yes it is. Yes, so it's also in Italy, I suppose.
Definitely.
And the pharmacists, they started to ask for sexologists' opinion here in Romania, because they started to be afraid of the adverse reaction of this kind of drugs.
Well, the safety of the drugs used for sexual medicine is not so bad. It is true that we have one of them, which is apanajul, which is definitely the most safe drug, and you can say that you can give to children because it's very, very, very safe. I'm joking, of course, but it is matter of evidence, the fact that this, according to all the guidelines and meta-analysis, apanajul is the most safe treatment. However, I do like very much the concerns of the pharmacist about the
adverse reaction.
not really just about the adverse reaction, but the fact that a patient who is going to the pharmacist, not going before to the doctor, is losing the possibility to have some kind of education, insights, and preventions about all the things which are very much related to the lifestyles which are provoking a sexual dysfunction much more time before more risky conditions or diseases or symptoms like the cardiovascular, like the metabolic, like the oncological one. So in other words, if I am a patient and I am coming because I have some troubles in the bed, I'm coming to the pharmacy and I ask to the pharmacist, can you give me some kind of drug? Okay, the apanajul is definitely the most safe drug that you can buy in the pharmacy. However, this is not my suggestion. My suggestion is to go to the doctor, because if that patient, that subject, I am, is going to the pharmacy directly, looking for a kind of fast, immediate solution, without going to the expert in sexual medicine, without going to the doctor, without going to the GP, without going to the urologist, without going to the endocrinologist, they will lose the possibility to prevent major cardiovascular event in the next 10 years, diabetes, as well cancer. So it's not making sense to me, the behavior of some patients to go directly to the pharmacy. I know that it's not so easy to talk about sexuality. Is something that is not just Romanian, it's also Italian, it's something which is Latin. For male is not easy, but also for female it's not so easy.
No, but in pharmacies, first of all, it's free of charge.
Yeah.
And that's then they are available all the time.
They are available all the time, and they are facing the patient since years and years.
Exactly.
They know very well.
Yeah.
So
many advantages for the people to go directly.
No question about it. That's the reason I'm also very much interested, and we did in the past a kind of educational system for the pharmacists in Italy in order to show them that they are facing something which is not faced by the doctors actually. Because a lot of people, for the reasons that you correctly said, a lot of people are coming directly to the pharmacy.
They cannot get apanajul without prescription in Romania.
Yeah.
They need a prescription,
Okay.
so they cannot go directly to the pharmacy for apanajul. They can go only for medical devices or supplements or things like this.
But not PD5 inhibitors?
No.
And no one pharmacist is selling the...
No. Well, I don't know, to be very, very honest.
Well, we did in the Italian television a kind of hidden movie, and one actor was going...
A mysterious client.
Yeah, exactly. Was going to the pharmacy, in 5 pharmacies in Rome Center, and he got the pill 4 times, and just one pharmacist said, I don't sell you the pill, and the 4 sold the pill. Okay.
Can be dangerous.
Yeah, it could. Trust me, is not really dangerous for health because the PD5 inhibitors are quite healthy drugs. It is definitely dangerous for the general health because those people are missing the possibility to use, let's say, sexual dysfunction as a biomarker. It is a difficult term, but I want to explain. Biomarker means something which is telling something now, biologically, which will happen in the future. So erectile dysfunction is a biomarker of major cardiovascular disease like heart infarction ictus, diabetes and other metabolic diseases, cancer and respiratory diseases. And this occurs many, many years before the appearance of those tremendously impacting in the quality of life and in the survival of the patients. So in my mind, the idea that to skip them and to go directly to the pharmacist in order to get a very easy, very cheap, very fast solution, it is for the next night very smart, but what about the night of 5 or 7 or 10 years later? That night could not exist because the people will lose the possibility to go to the doctor in order to change the lifestyle, which is so much impacting into the not just sexual, but also the general quality and expectancy of life. So I'm not against the pharmacist, not at all. I'm trying to educate the pharmacist. I did in the past. I hope to do in the future because the pharmacists are facing the street patient.
And most of people are going to pharmacy, not to hospital.
They are going to the pharmacy
most
immediately. They knew the pharmacist since years and years. I'm always telling that one to the pharmacist. Okay, I have a patient with hypertension. And he is coming to my office. I make a diagnosis of hypertension. I prescribe the drug, any kind of drug for hypertension. So how many times I will meet that patient? 2, 3 times in my life. How many times the pharmacist is meeting the patient? Each month, once, at least once each month, for all the life, because hypertension is something which is usually present in all the life. So, which is my relationship with the patient? 3 times in the life. What is the relationship of the pharmacist with the patient? Once in the month, for all the life. So, I think that we have to face it and to consider that it's much more easy for the patient to talk with the pharmacist, which is definitely good. So the idea is that to use the pharmacist as a weapon, as an instrument, as a tool in order to show to the patient that, okay, you did the right thing to talk with me, to talk about sexuality. However, the food that you are eating is not good. The alcohol that you are drinking is too much. You cannot smoke, and you have to work more than you are working now. And those things they are not just for your hope of survival, which is something which is not so clear for many patients, but is very good for what you are doing next month in your bed. And we have a lot of evidences that changing the diet, changing the lifestyle, stopping to smoke, all those things are impacting tremendously in the sexual life. And with this regard, the pharmacist could be a wonderful educator, together with the doctor, but never selling the drug, that's it, but educating the patient. And in order to do it, we need a system, a program of education of the pharmacists, as we are doing with the doctors.
So at the 20th conference next year, we are going to invite a lot of pharmacists also and medical assistants in order to integrate the communication.
Good.
because
The point is that the communication with the pharmacist, I did have in my past many experiences in the countries where the pharmacist is allowed, more or less, to be the unique one facing with sexual dysfunction, like Egypt, like Turkey, like several countries where the people is not going directly to the doctor, never.
Because of their religion?
No, not only the religion, could be some culture, not just the religion. Could be the culture, but also the system, which making allowed the pharmacist to sell without the prescription of the drugs. So I really enjoy also this kind of education of the pharmacist. It is, of course, it's different. The language that you are using with a GP is different from that one you are using with endocrinologist. That is different with that one that you're using urologist, but the pharmacist as well as the nurse. There are different languages because all those professionals are facing different aspects of sexuality as well, different needs from the patient. And so it is important to understand that you cannot use a universal, unique language, but the language should be adapted to the listener, which is the common rule of the communication, actually.
Well, your message was really clear, and we can't wait to see you again.
I hope so.
Yes.
It's such a nice place, nice people. Here is my first time, I said, in Romania, and the fact that I enjoyed so much is making me hoping to be back as soon as possible, because the environment is really wonderful. Not just and not only the landscape, not only the environment, but also the people I meet here, the questions I received, everything was really wonderful. I really enjoyed it very much. I'm looking forward to be back.
Thank you very much.
Grazie.